means it's Medical Minutes presented by Lake Cumberland Regional Hospital. And as always, it's so good to have doctors and nurses and staff members of the hospital call in to keep us all safe and healthy. And this morning we have RN Ashley Hoseclaw on the phone with us. Good morning, Ashley.
Good morning.
It's so good to talk to you, and you are a lactation consultant among other duties at the hospital. So you help every day take care of families and parents and babies. And how did you get started in this field?
So I actually started my nursing career at Lake Cumberland Regional Hospital as a new nurse in 2005, working here in the nursery and on the postpartum unit. And that's where I discovered my love for working with breastfeeding moms and babies.
So what does Lake Cumberland Regional Hospital do, and what do you do specifically as a nurse, a registered nurse, Ashley, for moms and babies when they first come into the hospital, taking care of them until they leave?
So in my position, I'm the perinatal educator, and as you said, a registered nurse and lactation consultant. And so once they're here in the hospital, I make an attempt to see every breastfeeding mother during their stay. We can't always make that happen. I can't be here 24/7. But I do try very hard, and I do education and training with our staff nurses as well, so they're also able to offer that support to mothers in my absence. And we also have several certified lactation counselors who also have some training in lactation. So once mom and baby are admitted here to the hospital, we offer support through their stay with positioning, with latching, with offering guidance and education to them on what to expect. And then once they're discharged, that support continues. We don't just send them home and the support stops there. I tell our patients it doesn't matter if it's been a day, a week, or a year. If they're still breastfeeding, they have access to us. So they can call back and we can troubleshoot over the phone. And they can even come back in and see me, make an appointment. That way we can work one-on-one if they're having issues with getting baby to latch or supply issues, whatever it may be. They have access to that, and those services are always free for our patients.
And when we talk about lactation, we're talking about breastfeeding, right?
Yes, correct. Yes, breastfeeding.
And some moms choose not to breastfeed, some do. What are the pros of breastfeeding, and why do some moms maybe choose not to do so with their new baby?
So as far as with benefits for breastfeeding, there are many benefits for both mom and for baby. For baby, it is the ideal nutrition. Financially, it's a good decision for mom. It's going to help her return to her pre-pregnant state faster and, slow down bleeding. It decreases certain risks of certain types of cancer and diseases in both mom and baby. Baby is usually sick less often whenever they're breastfed, fewer issues with allergies. It's basically baby's first immunization. And so it's just a great start for baby and for mom. Now, some moms choose not to, and we'll support them, in that as well. But for the moms that want to breastfeed, we're going to make every effort to make that happen. I think that some moms choose not to breastfeed just for fear that they won't be able to, that they'll have difficulty, that they won't produce enough milk. And some, it may just be a cultural thing. Maybe their sister or their mother or people that they know formula fed, and they chose that route for that reason. So whatever their choice, as long as baby is healthy and thriving, we're going to support them in that.
And Ashley, as a nurse, there are some moms who aren't able to breastfeed. They might want to do so but can't. What are some of the reasons that women might not be able to produce their own milk and breastfeed their baby?
So I have found that it's often more of a perceived low milk supply or, a perceived problem than an actual problem. There are rare instances where a mom might not be able to produce enough milk or may have issues, but that is not the norm. Usually with appropriate support and guidance, most moms can completely, exclusively, meaning only with breastfeeding, can exclusively breastfeed their babies. It's just having that support early on because, as you know, new moms question everything that they do. Well, a breastfeeding mom, I think, does that even a little bit more because she is the sole source of her baby's nutrition. And so she is afraid she's going to be, I'm afraid baby's not getting enough, or I'm not doing this correctly. The latch isn't okay. And then that's where we come in. A lot of what we do, of course, is clinical, but some of it also is just encouragement and lifting them up and validating, their concerns and supporting them through this.
And Ashley, when we talk about, we hear sometimes about moms, in particular moms who work outside the home,
Yes.
pumping and keeping milk for their baby while they're away. Is that something that all moms who breastfeed need to do?
No, not necessarily. If they are not going to be working outside the home, then they may choose to just breastfeed directly. But I do encourage moms, if they plan to use a bottle at some stage, whether it's just for an occasional trip to the grocery store, an overnight stay, going back to school or work, I do encourage moms to begin to offer a bottle of expressed breast milk after breastfeeding is well established. And that's usually around 1 month of age. And if we wait a lot past that, baby may refuse a bottle, and that happens sometimes. And then you have a different problem if you do need to be away. But yeah, working with these moms as a lactation consultant, I can determine what their needs are as far as what type of pump they need, because there are a variety of different types of breast pumps. And then we can work together to decide what she needs and then make a plan for when she goes back to work or when she'll be away for temporary periods.
And typically, how long should moms breastfeed their babies?
So the American Academy of Pediatrics recommends exclusive breastfeeding for 6 months and then continued breastfeeding along with introducing complementary foods around that 6-month mark. And then as long as mutually desired by both mom and baby for 2 years or beyond. And these are also consistent with the World Health Organization recommendations as well.
And what if moms actually breastfeed for a while and then they want to stop doing so for whatever reason? What can they do and what do they need to do?
So, again, I'll have a lot of moms that will call, and we can troubleshoot this over the phone, and I can help them. Gradually is ideal if you can do it gradually, and that way they are not uncomfortable because obviously they're still producing milk. And so if they can slowly wean and slowly, cut out a feeding every few days, and that's ideal. But sometimes there are medical issues with mom or baby even that may not allow that. But when possible, if you can do it gradually, that's best.
And Ashley, what would be, as a nurse, some tips that you would give new moms who are breastfeeding, in particular for the very first time? And that's also a question. If moms have multiple babies, are they able to breastfeed every child?
They can, yes. Even moms of multiples absolutely can. My biggest tip is going to be just to trust the process, trust that your body is designed to do this. It starts preparing for breastfeeding during pregnancy. Even if the mom doesn't plan to breastfeed, her body is going to start that preparation. And, offering skin to skin, or we'll sometimes refer to it as kangaroo care, and this is where baby is placed directly on mom's chest against her skin right after delivery. So that first hour after delivery, we call that the golden hour. Spending time skin to skin there, that gives baby an opportunity to, lick and nuzzle at the breast, hopefully latch, and that really sets them up for breastfeeding success long term. So those are the biggies immediately after delivery. But then, leaning into that support that's available to her, not being afraid to reach out when they have questions. And, I have some moms that I talk to, once after discharge. Some I don't hear back from, and some I talk to weekly or multiple times a week. And, I love being able to offer that support to them as their breastfeeding relationship develops and changes.
And what about some new moms who've maybe just found out that they're going to have a baby and they haven't had a chance to talk to you yet, or maybe even go to their doctor for the first time? They might be wondering, does breastfeeding hurt?
Breastfeeding should not be painful. Now, early on, there can be some discomfort with initially, with baby latching. But working with a lactation consultant to get that appropriate positioning, the appropriate latching, that's going to make all the difference. And so just finding out what the resources are when they're pregnant. So we offer breastfeeding and prenatal classes here at the hospital. I do one each month. and I switched up between Tuesday evenings and Saturday mornings, hopefully to accommodate many people's schedule. And so we'll go over, tips and tricks and ways to get off to a good start. We'll go over all those things during those classes. And then they have my contact information, and they can reach out throughout pregnancy as they prepare and they have questions that arise. And it really helps their anxiety because they already have, met a familiar face, somebody that they're going to see later on.
Yes.
And then we have that relationship that, once they're here in the hospital and then discharged and beyond, once baby's born, they are they're more likely to reach out to me and ask for help because we have that relationship.
And how important is it from your perspective as a registered nurse that moms and families get good prenatal care when they find out they're having a baby, and when does that need to start?
So prenatal care needs to be scheduled after the missed period. Mom should reach out to her OBGYN at that time. They'll confirm pregnancy and determine exactly how far along she is. And, of course, preventative care is so important, and that's where it starts. Some moms may be on medication or doing activities that could potentially be harmful during pregnancy and not even realize it. And so getting her in there to see her provider early on is going to make sure that she is doing everything she can to ensure a healthy pregnancy.
And Ashley, can moms who maybe did not give birth at Lake Cumberland Regional Hospital come see you? And how can people get in contact with you, moms, families, to talk about lactation questions and get help from you?
So they can actually reach out directly to my office phone. And do you want me to go ahead and give that number?
Yes.
Okay, it's 606-678-3176. They can also go to our website there, and we have information on registering for the prenatal and breastfeeding classes. My contact information is there as well, and they can contact me that way. We do primarily help those that are our patients that have delivered here, but if somebody needs help, we're not going to turn them away. We're going to help them as well, even if they didn't deliver here.
Yes. Well, Ashley, thank you so much for calling in this morning, and we appreciate all you and everybody does at Lake Cumberland Regional Hospital for taking care of our new babies and our moms. And we will put your telephone number on the Mid Mornings with Amy Facebook page so that if people want to get in touch with you, they can do that.
Great. Thank you so much. I appreciate it.
Thank you so much, and you have a good rest of your day.
You too. Thank you.